Katie Duncan is a national board certified Adult-Gerontology primary care nurse practitioner, end-of-life coach, doula, educator and speaker. She is also the CEO and founder of Death Care Coach, an organisation that aims to bring awareness to death and dying through private end-of-life support consultations and online training for families and death doulas. Katie is also a former professor of nursing and is a published author of 2 books, The Dying Process, Your Essential Guide to Understanding Signs, Symptoms and Changes at the End of Life, which is frequently ranked among the top recommended books on Amazon in death and dying. And Dear Caregiver, it's your life too. 71 self-care tips to manage stress, avoid burnout and find joy again while caring for a loved one. Katie's vision is to remove the stigma around death so people can live fully and die peacefully. She's dedicated to this mission by educating families and training individuals worldwide through her certified end-of-life practitioner program. Hi, Katie. Thanks so much for being here.
Hi, Kate. Thanks so much for having me.
Oh, it's so wonderful. I just wanted to know how you got into doing what you do.
Great question.
Mm.
So my background is actually in healthcare. I am an advanced practice nurse practitioner. I don't know if you have them in Australia. I
Yeah,
don't know if they're the same thing. Oh, you do?
yeah, we
Okay.
do. Yeah.
Yeah.
We
Over
seem,
here.
we seem
Sorry.
to have gone the same way as America. We used to just
Okay.
have, 2, 3 levels of nurses, and now we've got about 5 or 6. So,
Yeah.
yeah.
Yeah, it's so funny. I've actually been here I've been in the UK for the past couple of months, and it's very different here. They don't really seem to have advanced practice nurse practitioners here, so they're like, I don't really know what that is.
Right. So, are
Yeah,
you working there?
no, I'm just here for holiday, but
Right.
back home, yeah, I'm
Yeah.
practicing it. Yeah.
Wow.
Yes. So my background, I'm an advanced practice nurse practitioner. And so primarily I am still working clinically a little bit, though I've taken a really big step back from working clinically. Before becoming an advanced practice nurse practitioner, I worked as an ICU nurse. I was in the intensive care, and then I spent many years as a home hospice nurse as well. So that was really where I found my love, my passion about end of life care, talking about it, educating about death and dying. That was just where I found my niche. So I am still working as a nurse practitioner, like I said, primarily in nursing homes with older adults, many of whom are at the end of their lives. But what got me into my end of life coaching or doula role was actually going through my granddad's dying process and his death. So back in 2019, make a long story short, he was this pretty healthy 90-year-old. He suddenly ended up with this acute infection. He went to the hospital, and he really was just never able to fully rebound or recover. And in the hospital, I don't know how it is in Australia, but it was test after test after
Yeah.
test. Let's do
Mhm.
scan after scan after scan. There were no conversations about end of life or hospice or palliative care, death and dying, nothing. So it was actually our family who had to say, I think it's time, enough is enough, and we'd like to bring him home on hospice. So we brought him home, and he died a week and a half later. During that time, we only saw the hospice nurse twice. So it really, for me, was a wake-up call. I think on the healthcare side of things, I always knew that there were those gaps in care. And I think those gaps exist no matter where you live and no matter where you work. Hospice is amazing, but there's still gaps. And so that's when I said, now I'm experiencing it from the family side, and I'd really like to find a way to fill in those gaps. So I took a big step back actually from my healthcare practice, and I combined my healthcare experiences with my coaching practices and my doula practices and training. And I put it all into one. And now I'm practicing primarily as an end of life coach, but I'm actually now even doing more education. So I'm training other end-of-life doulas, which is wonderful.
Yeah, we definitely need more out there because having someone who has a terminal illness in the family, that's really, really difficult to know, to know what medical help you need as well, and whether they actually need hospice or, palliative care or whatever they need. It's really difficult to get information like that.
It is, it is. I'm not, well, I do sort of know some of the reasons, but it's really interesting just from the healthcare side of things. We're not trained in death and dying. We're not trained to have these conversations around end of life. We're trained to fix medical problems, and dying isn't a medical problem. Dying is a human experience. And so I think there's just this one, I think, lack of training and education in death and dying and end of life care and support and conversation. And I think from the human side of things, I think generally from both families and from healthcare professionals, we're all human. And so it
Mm.
feels like if we don't have something to do, then are we giving up? I think that's a big question that it really comes from both sides.
Yeah. Oh, right. Okay. So as a medical practitioner, like, how do you know when enough is enough?
Yeah, good question.
Mm.
From the medical side of things, from the healthcare side of things, there are guidelines that tell us, depending on, for example, if they have a chronic long-term disease. There are guidelines to show us and tell us when someone has reached the end stages of that disease and when treatments that we have that have prolonged their disease process are no longer going to prolong that disease process. It's reached its end. So we do have those guidelines. We also have guidelines that kind of show us when there's not a specific chronic illness that's reached its end stage. We have other guidelines that are showing us when someone has had frequent hospitalizations or they have been losing weight unintentionally and there's no particular reason for it, when they're just kind of failing to thrive, like their body is just failing to thrive. Those are other sort of guidelines that we can look at to say, well, maybe this person really just is at the end of their life.
Yeah. And what about the family point of view? I know there's a lot of guilt that is involved with, maybe they're intubated and you need to extubate them and maybe they won't breathe after that. And there's a lot of guilt that goes along with that.
Yeah. Yeah, I think that's going to be a part of probably a lot of people's grief experiences too. I think guilt is pretty common when someone is grieving. Um, and I would say I think that is where, if we're thinking about, like, maybe an ICU situation, and someone is on life support, I always think about uh, advanced directives or living wills, and even maybe more importantly, if someone doesn't have a living will, w- what matters most to them? What have been their priorities in their life before, and is this how this person would want to continue living?
Mm.
Um, so sometimes it's just thinking about the questions of, if dad were here to tell us what he would want right now, what would he say?
Yeah. It's so difficult. Like, I'm aging, like, and I feel that I think more about death now than I ever did before. And it's thinking about my health right now. If I, had something terrible happen to me, that I may or may not be able to be saved. It's like, I don't want to be. But then later on, I think, what if I'm really frail and and I don't know what's going on. I still don't want to be, but if do I make the right decision as well?
Yeah. Yeah.
So, yeah,
Yeah. I think that's a question that we all think about.
yeah, yeah. I think, yeah, but it's really good to talk to your family about that as well. So,
Yeah,
yeah,
absolutely.
and keep them up to date with
Absolutely.
everything.
Yeah, yeah,
Yeah.
absolutely. Yeah, it's one of the things, it's I ask people, do you have a living will or do you have an advance directive? And they say yes. I say, well, does your family know what you have? You talked to your family about these things?
Yeah,
Yeah.
yeah, yeah,
The more conversations we have, the easier those really hard decisions, if we're ever put in that position, the easier those decisions will be because we've already had those conversations.
yeah. Yes, that's right. And I feel that they possibly won't feel the guilt that, the depth of guilt that goes along with that because it's actually written down or it's been in conversation with the whole family as well. So, yeah. So also, some after people have been diagnosed with a terminal illness, I know in my experience, people feel terrible talking to their family about the pain they're in or what they're going through, and they don't want to burden the family at all. Have you come across that, and how do you deal with that?
Yeah, good question. Yeah, I would say that I come across that and in different ways. I I'm thinking about one client in particular that I was working with, and she had a really hard time. She had decided that she was ready for hospice and she was appropriate for hospice. So she went on to hospice services. And she was afraid to tell her family and friends that she was on hospice, that she had decided to go on to sign on to hospice services. She was afraid, I think, to burden them mostly with not wanting to upset them. She never wanted to upset her family and her friends. And I think when she finally kind of came to this decision that she wanted to tell them, she didn't know how to tell them.
Mm. Yeah.
And she didn't want them to think that she was giving up. I think that's a big
Yeah.
thing. Yeah.
Yeah, that's
Um,
right.
the way that I handle that, when she came to me saying, "Do you think I should tell my family and friends?" It, they're always hypothetical questions. I never, whenever I'm with a patient or a client, whoever I'm working with, I never want to just give them answers because those would be my answers. I want
Mm.
them to find their answers. So it's questions like, if hypothetically, if you were in their situation, would you want to know?
Mm.
Or if you were in their situation, how would you want to find out? Or what would you do if you found out this information if you were them? Is this something that you would want to do, and what would you do about it? So it's kind of putting hypothetical questions into their minds, my patients and my clients, and it's helping them figure out what they think is best.
Mm.
And sometimes it's not telling them right away. Usually they do get to that point, but they have to be ready to do that.
Yeah.
So that's how I sort of guide my clients, is helping them just discover their own answers and what the next best step is for them.
Mm.
Um,
Mm.
and oftentimes in this particular situation, she'd actually had a friend who was dying, and her friend didn't tell her.
Oh, wow.
And she was really upset about it. And she said, I wish that she felt comfortable telling me. And I wish that I could have supported her, known and supported her. And that made her say, oh, now I get it. Now I want to go tell my family and friends because I would want to know and I would want to be able to support them. And I'm sure they would want to support me.
Yeah,
So,
yeah, definitely. And I know on Instagram you were talking about not fighting cancer, not having those sort of things don't, I didn't survive and I didn't fight, it's just, yeah. Can you talk more about that? Because that was just so beautiful, because it always feels like then if you've got to fight, you've given up if you've died.
Yeah. Yeah. Around, I think it was really around World War II, World War I, World War II, where we really kind of developed this battle language around death and dying, because people were dying in battle. And so we sort of, I think, brought on that language for universally dying. And it's a really difficult one. We hear these euphemisms or this battle language of they lost their battle to XYZ, or they fought a hard fight, or they didn't fight hard enough, or they lost their fight. This battle language, making it seem like death is this thing that is a win or loss
Mm.
thing, and
Mm.
it's not. Um, and what I have found with my clients and the patients that I have supported and cared for is that they don't feel like they've lost. They don't feel like they don't feel like they've been a fighter. It's that this thing has happened to them, and it's now something that is just a part of their life, and they're working through or had to work through, and now they've reached a point where um, there's not something that's going to help them continue living. And
Mm.
so um, when that language is used, a lot of people have kind of shared with me that they do feel like they didn't fight hard enough.
Mm.
And they don't want to feel like they didn't fight hard enough. Those are some of the words that are often used. I'm afraid my family doesn't think that I fought hard enough.
Yeah.
Uh, and then that person feels like a failure, but dying isn't a failure.
Mm.
Um, and I think it's just really, it's language that can be really harmful for someone who is going through this human experience.
Yeah. Yes. Yeah. And it's sort of glorified by the media. They always say, like, I haven't heard media say, somebody, because Robin Williams always sticks in my head, like he lost his battle, and like, it wasn't a battle. He just had something that he didn't know, and then he died. And it was just awful. But that's the media thing, and it's always the headline, which I don't know how we're going to change that at all.
Yeah, if that's a bigger question of how do we change the wider society.
Yeah.
And maybe it is just one person at a time. Maybe
Yeah.
it's one conversation at a time, and then people having these conversations all around the world.
Yeah.
Um,
Yeah.
and bringing it to people's awareness, I think, is the other thing, because you don't think about what you're not aware of.
No, that's right, exactly. And even using a death, the word death, it's like this horrible thing that they always, they use passing away or past. And I remember once my friend on Facebook, she said, "Oh, my dog sadly passed over the Rainbow Bridge, and we've got a Rainbow Bridge down the road from us." So I thought, I'm going to go and search for her. And I was looking for this dog, and then I thought, oh, I better see if she's found her. And it's all, RIP and all this. And I thought, why couldn't you say the dog died? I'm so glad I didn't say I'm looking for it. But there's a whole lot of things, with children, grandma didn't wake up, she's sleeping. And it's just so sad for them.
Yeah, it's another, this is the big, it kind of, that really falls into the euphemisms around death and dying.
Mm.
there is this taboo. It's taboo. It's this hush hush. We can't say the word death. We can't say the word dying. And I do think that parents, I have tons of nieces and nephews, and actually we've had a recent death in my family, and my sister is really struggling to talk about death and dying and say those words and explain death and dying to my nieces and nephews. And so there are those words, passing away or passed over or they lost or they're sleeping. And then the child is going to take that literally and think that just like they're going to go look for grandma, they're going to go look for whoever that is, or they're going to start to be afraid to go to sleep because grandma went to sleep and she's never woken up, things like this. And it really, I think, only adds to this hush hush topic, this taboo topic of death and dying.
Mm.
So that's another societal change that I hope that having these types of conversations can change over time and make people more aware of the language that we're using around death and dying.
Yes, yeah, yeah. And even, oh goodness, it's just gone out of my head. Because
That's okay. Happens all the time to me.
do you know what? Usually I pick up on something and then I'm trying to grab it back and it's not working.
Always, yeah.
So yeah. So what do you do? Like, how do you help people deal with the fear of death? Because towards the end of life, I would imagine there would be fear in that.
Yeah. Yeah, there is absolutely. I think um, most people have some fear. There are some people who feel totally at peace with dying and totally at peace with death. But probably more often than not, people have some fear of dying, whether it's the fear of dying itself and the things that will be happening, and they're afraid of what's going to happen, or the fear of death and what happens after death. I'd say those are the two most common fears that I come up against when I'm working with patients or clients. And I would say, generally speaking, when people have more of a fear of dying and what's going to happen to them, one is just giving them space to talk about those fears so it's not inside of them. I think that generally lessen some of their fears, just being able to talk about it. But the other sort of big thing that I offer to clients, if they want, is I ask them if they'd like to hear my experiences with people who are dying, and also if they'd like to learn what's normal and what's expected. And usually people say yes. And I think as I'm sharing what's normal and what's expected, I'm also sharing that dying isn't painful itself. I think that's one of the biggest things people are afraid of, is that dying is painful. And dying isn't painful, but disease and the manifestations of disease can cause pain. Um, and we also, at the same time, have different treatments to help people feel more comfortable, both medication wise and non-medication wise too. So for me, one of the priorities is always making sure finding out how that person wants to feel. What do they want to feel like? What makes them feel comfortable? And what are their priorities when they are dying? If they're having pain, how much pain is too much pain? What are the things that we can bring into their environment to make them feel more relaxed and calm and comfortable? How do they want to be cared for? Things like that. So when they find out what's normal, that there are things to treat any sort of discomforts for them, and when they start talking about how they want to feel and how we can create that for them, that seems to really help people feel more comfortable. So that's sort of the dying aspect. From the side of fearing after death, it's really interesting because I find this is pretty universal. Sometimes I hear people say, well, people who have more of a spiritual sense that there's something that happens after death, or there's some sort of an afterlife seem to have more peace. Yes, I have found that, but I've also found people who are very spiritual or have practiced some religion for their entire lives also have that question, that fear. I think there's always this question of the unknown, because when we actually get to the last days of our lives, I think people start to think, well, we may have believed this all of our life, but I guess we don't really know. And so again, it's giving people that space to talk about. And then it's, again, I think just sharing my experiences of when people are in those last moments right before they die, that people do seem at peace. And so I think just knowing that those were my experiences and that people have been dying for as long as we've been alive, I think that gives them some sort of peace of mind as well.
Yeah.
That they'll be okay.
Yeah. I know when my dad died in 1989, but he had 2 years of cancer, and back then the treatments weren't great. And he was, like I always say, we're Catholic more than Catholic. So he really believed in Catholicism, but then the church didn't rally round him at that time. So he moved to Buddhism, and he really found peace in Buddhism. And he just said to me one day, wouldn't it be funny if there was absolutely nothing after I died? And I thought, it would be funny, wouldn't it? But I don't think so. I've seen him since, so I know he's there. Yeah.
I want to hear about this.
Oh, well, my dad died, our youngest daughter died in 1986, and then my dad died in 89. And I was laying in bed, and we have an ensuite just alongside our room. And I was just laying there and just my eyes open, and I saw this blue light, and there's no blue light around. And then I saw my dad holding my daughter's hand, and they just looked back at me. And it was just, I thought, she's okay and dad's okay. So,
Wow.
yeah, it was just, and, it was just so moving that I just, I believe that there is something there now.
Yeah. Wow. That's amazing.
Mm.
It actually, this reminds me of when my grandmother died, one of my aunts was taking care of her throughout her dying process. And just after she died, very similar experience. She saw this cloud that was in the shape of a heart, and it kept this cloud kept showing up. I mean, like literally right at her back door for the few days following my grandmother's death. And it just, every time she said, this is mom, this is mom, mom's here, mom's okay, mom's at peace. And it's these stories, it's these experiences too that I've had that I'm not a religious person, but I would say in my experiences around death and dying, it's especially made me a spiritual person. In just believing that there is something beyond what we know here in this physical world, physical body. Um, yeah, it's amazing.
Yeah, yeah, yeah. I'd love to know the reality of it. Like that whoever, our universal person is, just say, yes, there is this, and they do go to a special place or whatever. I don't know. Oh dear. Yeah.
I
Um,
guess we won't find out until that happens.
no, that's right. Exactly. I know, because I think, my mother has since died too, and she had dementia. And I
Mhm.
always hoped that she would go back to, because she didn't even remember she was married. And mum and dad had a beautiful relationship. And I always hoped that dad would find her and just take care of her. And she'd go back to them being them. So, because when I saw Dad, he was well as well.
Mhm.
When You know, he wasn't emaciated or anything. He was himself. So I don't even know what that is, but
Yeah.
it's nice to think that, something's out there that,
Yeah.
yeah. And we need to keep talking about them anyway for
Oh, yeah.
generations after.
Oh, absolutely. Absolutely. I mean, it's carrying on their legacy, and it's helping us as well.
Mm,
Saying their name, talking about their memories, that's carrying on their legacy. And I think all of us, in big ways and small ways, and ways that we probably aren't even aware of, I think we all make ripples in this world.
mm,
And those ripples go on forever.
definitely. Yeah, because I was thinking about my family. I only know my grandparents because they lived with us and we were all very close intergenerational family, but I don't know their parents at all, so great grandparents or anything like that, because they didn't talk about them. So I have no idea.
Yeah.
Yeah, yeah. So I make sure everybody talks about everyone who's died in our family. So we keep it going. And the
Yeah.
memories, you find out things from different people that you didn't know that person was like. They were just totally different person to that person. And it's just
Yeah.
wonderful learning that
I
they were this full person.
yeah. I love those stories. And
Yeah.
not only that, but I also think about when you are in the same situation with other family members, every one of us perceives that situation in a different way, and we perceive our loved one in a different way. So it's always fun to talk about those stories too. I talk about it with my sisters and my brother, how we remember this time, and we all remember it differently.
Yeah, that's right. Yes. Yeah.
And it's the same with our relationships and the people that we love.
Yeah, that's right. Yeah. Well, I remember we were at a party after Dad had died, and I don't know whether it was his wake because Dad had a wake before he died as well, because he didn't want to miss out on all the stories.
He was
Ah,
above his time. He was, he
yeah,
was
he was. He was.
having a living funeral. That's amazing.
Yeah, yeah. So anyway, I overheard one of my, I'm the oldest of six, and I overheard one of my brothers saying, "Well, I was his favorite," and I went, "No, you weren't." So all of a sudden, there's all of us in there going, "No, I was his favorite." There was a massive fight, loving fight, but how can he do that? Make you feel that you're the favorite of everyone. But yeah, just so
That's
wonderful.
a gift. That's
Yeah,
a gift. Yeah.
yeah. I think I love sharing stories. I often hear people say, "Oh, but they didn't know my son, or they didn't know, my mum or dad or whatever." It's still sharing their story, sharing their legacy to, and helping people share their stories as well, I think. Because
Oh, absolutely.
yeah, I'm really big on stories and I do talk a lot.
Yeah, well, I think sharing stories, like when we are able to be vulnerable and share our stories, it allows somebody else to be vulnerable and share theirs. And I think you're right. I think the more that we can all share and be open and vulnerable, I think a lot of times we're holding these stories because we don't want to burden them with our story, but it's important, and it gives us all space.
Mm, mm. Yeah. And people worry about upsetting other people. And I think it's really not upsetting them. Like, you're sharing love that you've had with that person and, with a loved one of ours. So, even if they did die 30 years ago or 40 years ago, we really want to keep the conversation going and the story to hand to everybody.
Yeah.
Because
Yeah.
they're so amazing, such amazing people.
Yeah. And you never know what story is going to hit someone in some certain way that's going to change the way that they think or they see or they feel, or, yeah. I mean, sharing our story. I couldn't say more about sharing our stories, just being a part of um, sharing us, because it's our story, it's their story, it's legacy. I think it's also something that helps us through our grieving journey as well, because we get to replay those stories.
Yes.
Uh, yeah,
Yeah, it helps process your grief as well.
absolutely.
Yeah, because people feel grief differently. Like, as you say, we have the same experience, but we're feeling different. And, people hold back. Or I know my husband and I didn't talk a lot where after our daughter died because she was a twin and the other one was ill as well. So I was ferrying everybody around. So and she was in hospital a lot and we had a 2-year-old as well. So it was like just we didn't talk. And then about 10 years ago, my husband was talking to a friend of ours who had lost his son, and my husband talked to him, and that's the first time I've ever seen my husband cry. And
Wow.
I thought I was the one crying all the time in the shower, nowhere else, in the shower. And I thought he was just not feeling it. He was just going to work, coming home, doing his thing. I was doing everything, everything. But there was no conversation between us until that point in time when I said, I didn't know. Like, I just didn't know. So then we started our grief together rather than separate. So, yeah.
Wow.
Mm.
Yeah, wow. Yeah, there's so many thoughts that are coming into my mind right now, but of course we all grieve differently. And it almost, that sharing that almost makes me think, wow, and maybe we also grieve in the way that we're expected to grieve.
Mm.
Like I almost think about like gender roles even, or relationship roles or family roles, and what we think is expected of us. And
Yes.
so wondering if like some people feel like they need to hide their grief for some reason. Um, yeah, wow.
Well, you've got to
Wow.
be strong, don't you? Because if you look like you're falling apart, you need to get help. Whereas
Mm,
really, like I have people come to me 2 weeks after the death of someone. My friend said, I'm falling apart. Let's talk about grief. This isn't falling apart, this is grieving.
yeah, yeah.
So yeah, it's
Normalize it.
yeah, yeah. But
Yeah,
yeah, you've just got to be strong, because you can't look weak. Crying isn't good.
yeah, yeah. Or why aren't I over this yet? Why do I still
Yeah,
feel this? Oh yeah,
yeah, yeah, yeah. And grief is like this lifelong thing because you loved, you're going to lose, and grieve forever. So yeah.
yeah. I really love the picture of thinking about grief as this black hole, and then thinking that that black hole is now a part of you. That person, just died. It's not like they come back to life. So that hole is now a part of you too. But how with every life experience, we sort of grow around that hole. That hole's still there. It's still the same size. We just have more and more life experiences that are
Mm,
surrounding that hole, or
yeah.
that black dot, that
Yeah.
death, that loss.
Yeah, that's right. Yes, exactly. Are there any things that people regret towards the end of their life that
Mm,
they voice?
Great question. And I would say everyone is different. Some of the things that have come up more recently with my patients and clients are the like making the amends. Like they're thinking about the things that they wish they would have said or would have done, or what they wish they didn't say or didn't do. Um, coming to mind is one client in particular who had a falling out with all of his kids, with his ex-spouse, and really feeling like he wanted to make those amends. Even if he couldn't fix what was said or what was done,
Mm.
he wanted to at least have that piece that um, that he apologized, that he said his piece, that his kids and his ex-spouse had were able to say their piece, and just kind of find that connection again. Um, and I find that a lot is the making the amends, the forgiving or asking for forgiveness.
Mm.
Um, that is what I would say is the biggest thing for me, especially recently, that has been just routinely coming up, and I don't know why that is, but
Mm.
just is. Yeah.
Oh, yeah. So interesting. Yeah.
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 I would say, yeah, go ahead.
No, no, you go ahead.
Yeah. I mean, other things are, of course, I think about the people who, say they wish they spent more time with their family, or they wish they, took this trip or did this thing, that they didn't take, years ago. Um, I'd say those are sort of the smaller things, um, but I think people are slowly able to sort of come to peace with that as they're just really prioritizing the end of their life and how they want to spend that time. And they're now spending that time with their family now.
Mm.
Um,
Yeah, yeah. And they've had a block of time without them. The ones left behind, that would feel a bit hard, difficult, that they had that block of time that they could have had this restoration of relationship.
yeah,
Um,
yeah,
yeah.
absolutely. Yeah.
Mm. So, Katie, do you sit with the family, or is it just the dying client that you sit with?
Good question. Both. It really depends. It depends on who has sort of brought me in and how they wanted to bring me in. So sometimes I am working just with the person who is dying. Sometimes I'm working just with the family. Sometimes it's the whole family. Sometimes it's one family member. And sometimes it's everyone all together. Because they would like the family as a whole would like guidance through this journey.
Mm.
Um, yeah,
And
so it's often
yeah,
both.
yeah. So how do they find you?
Oh, good question. I would say a combination of things. Word of mouth is one. And two, I would say social media and or my website.
Right. And where are you in the US? I don't even know that.
So I am in, good question. Currently, I am in Maryland in the
Oh,
US.
no.
But people that I work with aren't always local. Sometimes it's families who want to connect with me from far away. So sometimes I'm actually working with people from other countries or across the country. So it really just varies.
Right. So do you do that via Zoom, or are you traveling?
Yeah, no, it's that would be anyone who's long distance is via Zoom. Yeah.
Right. Oh, wow. And before you mentioned you did a doula training, a death
Yeah.
doula training. What's that?
Yes, so it is our certified end of life practitioner course. It is an 11-week course. There are two options. Some people choose to do self-study, so the 11 weeks all on their own. And some people choose to do it with a community, with a cohort. And so this is really an ongoing and growing community that we're building. But for 11 weeks, people will go through this 11-week program with a cohort, and once a week, we will meet all together as a cohort and reflect and do case studies and do other exercises that just expand our knowledge, our skills, our training, as end of life practitioners, however we end up practicing. So it's designed for people who would like to become end of life or death doulas, or end of life practitioners. But what I've found is that a lot of people are coming from healthcare or the like. So nurses, nurse practitioners, social workers, therapists, counselors, And I'm also finding that it's a lot of people who have just gone through this experience with a loved one, and now they want to learn so that they can prepare themselves and for any other family members or friends that are going through the dying process.
Wow. Oh, gee. That sounds amazing. It really does. And I think more people need to do that as well, because it's just amazing information. And even knowing, the process of dying is, yeah, I think that's so important because on movies and things like that, it's extremely dramatized and unrealistic.
So unrealistic. And I think that only is really adding to the fear and the stress and the overwhelm of it all, is because we're seeing what death looks like in the movies and dying looks like in the movies, and that's not what it's like in real life.
Yeah, yeah, that's right. Well,
Yeah.
I think we will end it there. Thank you so much, Katie. It's been so informative.
Oh, it's been so good to chat. Thank you so much for having me, Kate.
You're welcome.